Because if you got a business, you didn't build that. Somebody else made that happen. If you've been successful, you didn't get there on your own. You didn't get there on your own. I'm always struck by people who think, well, it must be because I was just so smart. There are a lot of smart people out there. It must be because I worked harder than everybody else. Let me tell you something. There are a whole bunch of hard-working people out there.
For over 25 years now, we're a big part of the West Michigan community, and we handle larger clients throughout the state of Michigan, specializing in employee benefits. And obviously, one of the landmark legislation that was passed in 2010 was the Affordable Care Act, is what it's now being called. That legislation has had a tremendous impact on not only our business, but every business across the country, small and large. I think one of the things that is going on in America today is the uncertainty in what it's doing to businesses, being able to plan ahead. That is just not possible right now. I really think that America and business owners in America right now are feeling a pinch. They're feeling the regulation coming out of Washington, and keeping up is just exhausting. Our job is turned into the weekends reviewing guidance that is being released from Health and Human Services on the Affordable Care Act, and it's very difficult, if not impossible, to keep up with all the guidance that's coming out right now. And I know that's just our industry, and other business owners feel the cost of regulation that they have to. We're expanding Medicaid, and one of the issues with Medicaid is it doesn't pay the doctors and hospitals what a private insurance company would pay, for example, and adding to the roles of Medicaid is really putting a squeeze on your doctors and a lot of your primary care groups. And I just read a study that a third of physicians are going to be leaving the business throughout the United States in the next 5 years or so. So a lot of people that are close to retirement that would normally pass on their client base to a younger doctor, that's not going to be happening because it's just not profitable. And that's a problem that we're going to have, is a big doctor shortage.